Hi everyone, this is Simon Billings from the InHealth System, and this presentation is all about vitamin D. In part 1 we're going to cover the symptoms and the diagnosis, then in part 2 we'll go on to sources of vitamin D from the food and sun, and then we're going to cover supplements and how to get healthy sun exposure. So there's a lot of interest in the press. The NHS have finally realised that patients are simply not getting enough sunshine and therefore are low in vitamin D, and that's now causing a plethora of symptoms. But what are those symptoms? So the key one that most of you may be interested in is in pain. Now that can be chronic low back pain right in the middle of your spine, or it can be aches and pains through different joints in various parts of the body. It can also present as diffuse, broad muscular pain, and that can be in the back, the legs, or the arms. And in children, that will often be misdiagnosed as growing pains. It can also cause very severe fatigue and also symptoms of mental health disease. Now that may represent a previous diagnosis of depression or anxiety, but the key thing is that this is a symptom of vitamin D deficiency and not necessarily the cause. Now, how severe these symptoms will be from your vitamin D will depend on how low you are in vitamin D in the first place. The lower you are in vitamin D, the more likely you are to have more severe, obvious symptoms of pain, stiffness, and immobility, along with fatigue and symptoms of mental health. So for some of you, if it's very, very low, it might be that one thing that's going to make the really big difference, a silver bullet that's going to turn your life around. But for many of you, it'll be one piece of a health jigsaw, including the way in which your spine and joints work and your nervous system, that will be part of an overall picture of health. Here's an example of a piece of research in patients with vitamin D deficiency suffering from severe pain. Now, if you look at the chart here, what happened was at the beginning they had a score of 80 out of 100 on a pain scale, and over a period of 6 months on high-dose vitamin D, the pain dropped to around 40, and that's about a 50% reduction in a 6-month period. A very impressive reduction in symptoms, but not a complete resolution of the pain. And no doubt that there'll have been other areas of their life that needed to be addressed, including, of course, their joints and nerves and muscles, along with other areas of lifestyle improvements. And note also that the improvements took 6 months in total, but there was a good 25% improvement within the first few weeks into the end of the first month. You may, of course, also have been misdiagnosed with a previous symptom. So if you have aches and pains in your muscles from vitamin D deficiency, it's very possible you'll be misdiagnosed with fibromyalgia. If the vitamin D deficiency is causing severe joint pain, then you may well be misdiagnosed with osteoarthritis. The fatigue could be misdiagnosed as chronic fatigue syndrome, and the lack of pleasure in your life may be misdiagnosed as depression. Now let's talk about the actual levels that constitute deficiency. So anything under 25 nanomoles is going to be considered grossly or severely deficient. Now, and when you're in this level, you are absolutely going to know that you are not feeling right, and you're going to have overt symptoms. Now, it may be one or all of these, but you will certainly know that you do not feel well. It could be any of the aches and pains across the body, joints or spine. It could be the severe fatigue, or it could be the mental health type symptoms that are developed. And remember, you may well have already been misdiagnosed because the symptoms were so severe. Now, when you get between 25 and 50 nanomoles, that's considered deficient. And up until this point, the NHS will certainly agree with us. Once you get above 50 nanomoles, they would call that adequate or sufficient, or they might simply say that you are normal. So anything under 50 is considered deficient. Between 25 and 50 nanomoles, you will certainly still have some symptoms. In these range from aches and pains to fatigue to mental health type symptoms, but they may well be much more subtle and your awareness of them may well vary. Now, whether or not you have symptoms when you get above 50 nanomoles from vitamin D deficiency in this area, then that will depend on your genetics. Some people have a genetic defect in the way the vitamin D works, and so even when they're in the 50s or 60s, they can still have the symptoms that would mimic if they had levels under 25. And in that scenario, they'll need to get their vitamin D levels much higher. So between 50 and 85, we generally consider insufficient. It's okay, but it's not optimal. And this is based on research that shows that if you take a patient with 50 nanomoles and compare them to someone with 85, the group in the 85 has 65% more absorption of their calcium from their diet. Now, if you have osteoporosis, this is a very significant amount of calcium indeed. Now, anything over 85, we're going to consider adequate. But then the question comes, what is considered optimal? And for this, we look at studies of people who work in sunny climates who are exposed to sunshine regularly, from lifeguards to farmers to tribes people in Africa. And generally, what we'll see is that levels go between 100 and 200. So what we were going to try and do is say the optimal is between 125 and 200 nanomoles. That would be an optimal level to aim for with supplementation during the winter and sunshine during the summer. We're going to try and mimic living in a sunny climate year-round. Now, in the UK, how would we know how deficient we might be? Well, let's look at the research. So if we look here, the level here is 50 across the line, and here's around 75 to 80. So 50, anything under 50 is deficient. Anything from 50 to around 85 up here, 75, is going to be considered insufficient. And you can see here at the end of September here, the levels begin to drop. And then this is the middle of winter, they're very low, and they come back up again. So anything under 75 is insufficient, deficient, and in this study, 60% of the entire UK population at the end of a long summer, which is at our highest point of vitamin D all year round, are still in the deficient or insufficient range. At the end of winter, the range then drops, actually goes up to 90% of the entire population are below 50 or 75 nanomoles per litre. That means that the vast majority of the population in the winter are deficient. Okay, that's the end of part 1. And in part 2, we're going to cover the sources of vitamin D from food and sunshine.